All right, this is Josh, Dream Body Clinic, here again, Dr. Jacoby, and we were just talking about, you got a new book that's coming out soon, right?
I do, and if I get more relaxed down here at Dream Body, I'd never get out. Yeah, it should be out in about 2 months. I did want to finish it up after I visited your clinic, because it's very important that the tone in the book is not anti-American medicine. It's pro-stem cell. And How to Get Unglued is the name of the book. I'm really big into the fact that you need to reset your epigenetics.
Got it.
And obviously, what a better place than resetting your epigenetics than in Mexico.
Yeah.
And I mean, it's just such a different environment down here. I'm hooked up to the IV right now with the stem cells. When I got a...
So we just did 100 million in the IV, and now we're doing the vitamins. I like to think of the stem cells, they're like the manager on the construction site, guiding the repair, and want to make sure they got enough bricks to build the house. So
God, that's exactly what I use in my metaphor. And it's that simple. I mean, as we wear and tear through life, we need some reconstruction.
Yeah.
We need a good architect, and you're that architect here in Mexico, for sure. We talked about a lot of things on this trip, and I was just talking about the Battle of the Nile.
yeah,
Which is a fascinating story of where all this epigenetics started in 1794 with Etienne Geoffroy Saint Hilaire and his debate with Cuvier in the late 1700s. What was the story? Was it Darwinian or Lamarck, or was it really epigenetics? And he started that whole concept. And here we are a couple of years later, and you're using stem cells, and we can't do the things that you're doing here that in the United States. Now, we can use certain things. We can use umbilical tissue, long as it's homologous use, and that is such a difficult thing to explain. Homologous use means like for like in Latin, and using the umbilical cord, which is supportive tissue of the umbilical cord, the Wharton's jelly. By the way, we talked about that yesterday.
Yeah.
John Wharton, 1600s, from England, he got his name on this supportive tissue. And we can use it as long as homologous use, meaning if the conduit from the mother to the baby is a conduit, the umbilical cord, then my thinking, we certainly can use it in a neurovascular bundle such as carpal tunnel or any other neurovascular bundle. In my field, in neuropathy, certainly we can use it down there. Now, the FDA may not agree with me totally, but I'm trying to use the homologous use, as long as you use tissue that's minimally manipulated.
And you were saying why you think it fits is because most people don't know, but there's a big nerve that goes through the umbilical cord, correct?
Yes. So in my investigation on the umbilical cord, which I did not have a lot of knowledge years ago before I started this, the umbilical cord is an amazing structure when you really think about it. It's a neurovascular bundle, and we have artery and nerve connecting the mom and the fetus, and there's also a nerve involved, which I did not know, and and the reason is because it has cholinergic tissue, which means that it has a neurovascular component. But you can cut the umbilical cord and not cause any pain to the baby or to the mom, because there are no nerve pain receptors. And that was something I didn't realize.
Yeah,
but when you think about nature making those accommodations for us, we wouldn't be here. The other thing I learned about umbilical cord is that from the C-section, where the umbilical cord is taken, most labs like to process them within 36 hours, which is another unusual concept, that it is a live cell and probably past 36 hours, but ideally you want to get them in that time frame. So I guess nature provided that a fetus delivered, the mother didn't always survive, but the baby could survive for 2, 3, maybe 4 days with the umbilical tissue Wharton's cells that were giving the baby a chance to survive.
It's incredible. I mean, it really is. And you got the fact they find in bone marrow of mothers sometimes. There was one case, I think 16 years later, they found male MSCs in her bone marrow. And it was because, like, that nerve detected the mom had some damage or inflammation, and it sent over some mesenchymal stem cells. And even though they're different HLA, they're two different people, they lack the HLA. So there's no, that's why we're able to use these from umbilical cord. They're immune privileged, basically.
Well, you and I have been doing these cells for a long time. Even the word mesenchymal stem cell or mesenchymal stem cells, some people like to pronounce that. And are they really MSCs in the first place? Arnold Kaplan supposedly had given the name MSCs to that. He would like to call them now medicinal signaling cells. I think that probably is a better term.
He told me at a conference, he said, we want to rename them MSCs, most sexy Kaplans.
Yeah, right. And we got to give him a shout out to that. But it is amazing that the simplest thing in nature has the most profound effect. And here we are in Mexico doing these cells. I'm doing them as an IV. This is my first time IV. In the States, I did have a partial tear in my rotator cuff. I had injected locally Wharton's jelly. And I also had an L4, L5 herniated rupture, which was really painful. And I believe you had that similar problem.
Yep.
And localized injection, which sounds like it's scary, but it's really not. I did not have it intrathecal. I had it intramuscular, basically, around the neurovascular bundle. And in 3 days, I was back playing tennis, which I played every day since I've been here, by the way.
That's not easy on nerves, joints, anything.
No.
It's hard.
So, yeah, and it's hardcore. That does take its toll. But, being here at your clinic and having been to a lot of clinics around the world, and similar was Dr. Reardon's clinic in Panama, has the same kind of feel, use the same type of treatments and protocols. It is safe, it's effective, it works on just about anything. But having said that, we do need more research.
Definitely.
And it is being done, but we're not doing double-blind studies, which is hard to do with something like this. But it is safe. Now, this question of non-embryonic versus embryonic, and I know you had a personal experience with that with a family member, and you may want to talk about that, I don't know, and treatment of ALS and things of that nature. So, embryonic stem cells are not being used for the most part around the world, although I understand they were being used in Ukraine.
Yeah, there's a couple in 2 clinics, I think, in Cabo also that do it. But it's weird. I've talked with one of the biologists up there at Langton. It sounds almost like they're doing MSCs, but using this aborted fetus or embryo as like the donor source. It's really confusing. It wasn't what you would expect. Even in the one in Ukraine was the same thing, and that was M-cell. Because when you talked with them, it sounded like it was more of a mesenchymal type stem cell. It didn't sound like they were becoming the tissue or cells that you wanted them to become. So I don't know. It wasn't what people imagine. Oh, it's a stem cell. It just becomes what's needed, because that's not usually how that works out. It usually requires some other manipulation.
I was at the Perinatal Stem Cell Society meeting about 5 years ago in Utah. And there was a scientist from the Vatican and gave a great talk. And she was differentiating between embryonic stem cells and non-embryonic stem cells. And this is non-embryonic. So some people call them adult stem cells because they're from the umbilical cord. So once it is severed, now they're adult. It's kind of an odd...
Really confusing.
Really confusing. But she gave a great lecture, and she talked about the gene expression before and after treatment, in which there is a definite change in the gene array. And also there was a great talk by Dr. Joanne Kurtzberg from Duke on autism and also muscular dystrophy. And she was using hemopoietic stem cells. So I think we ought to differentiate again on that point. So the umbilical cord has blood components, and the Wharton's jelly does not. But you can mix those, and she was using both. And I asked her how long she'd been doing it. It's 30 years.
Oh, wow.
At Duke. And I said, Dr. Kurtzberg, why is this not mainstream? Well, her answer was, we need more research. We need a grant. Now, I kiddingly say, need a grant means I need more money. And that's how that's their business, is getting grants, doing research, and always each year is more money, more grants. Now, my son, one of my sons, his name is Grant. I said, well, I get that. That must be Latin for give me a big check. What do you think? No, he doesn't like that, but he's such a good kid. But so yes, we do need more research. But talking about Joanne Kurtzberg's study, which was a terrific lecture, by the way, I'm not putting this down, Dr. Kurtzberg, but she had kids that showed as the spectrum disorder we call autism, and these kids could not speak. Showed the gene array before the hemopoietic stem cell were given, and these kids could talk.
Wow.
And she showed the gene array afterwards, and they reset the epigenome. Mm-hmm. These are epigenetic diseases. And she also had muscular dystrophy. So kids that couldn't walk were now walking after getting hemopoietic stem cells. So I asked her afterwards, and I said, Dr. Kurtzberg, so we're really not talking about genetic diseases, we're talking about epigenetics. Because if it was genetic in the genome, it's immutable, it's not going to be changed. But epigenetics means you can reset them.
Yeah.
And stem cells do that, and they reset the genes. Now, these are kids that couldn't talk, talking. Kids that couldn't walk, walking. Now, not perfectly. So back to the discussion we had yesterday, when you get the stem cells, depending on what phase of your inflammatory disease are you in. If you're in the early phases, I think they work every time.
Yeah.
Latter phases, and the way I put my neuropathy patients in phase 5, once that fibrosis sets in around the neurovascular bundle, and it's in the leg, when it gets severe, then I'm trained to do the surgical decompression of the nerve, and then I use stem cells. Got it. So then I get good results. But I would like to use this in an IV, which we really, I shouldn't say we can't, but it's frowned upon by the FDA. And I think it's going to disappear in the States fairly soon. And do you want to talk about the 351 and 361 because of your audience? So let's talk about the legalities of the FDA.
Yeah.
And that's another really interesting question. Does the FDA have the authority to monitor doctors' treatments? I don't want to challenge that, but some people do. So right now they have declared amniotic tissue, which is the fluid in the baby's development. And during gestation, amniotic fluid does have stem cells in them.
Yeah.
Although amniotic fluid themselves are not really stem cells, but they're bathed in this fluid. So that's in the lungs, especially because that's what the fetus is breathing. Yeah. Liquid. And it's an amazing process. So the FDA, in their wisdom, said that amniotic fluid is not stem cells, it's a secretion, therefore it is a drug. Well, I don't think Lucy, our first primate, if we believe that Dr. Johansson. So amniotic fluid is a 351 designation by the FDA, which means it's a drug and you must be in a new drug application. It costs hundreds of millions of dollars, probably take 10 years, whatever you're testing it on. Yeah, knee, elbow, shoulder, back, all different studies. And it's going to take a long time to do those studies is going to be very expensive. However, they did leave a section called 361, which means that you can use tissue, not on a research study, if it's not more than minimally manipulated tissue, and Wharton's jelly, if it's biologically sliced down to small pieces of the whole, I assume that's less than minimally manipulated. If you add chemicals to it, then it's more.
Yeah.
That's condition number 1 for 361. But the real hard part is this word homologous use. And no one's could seem to figure that out. Well, that's my field, is neurovascular bundle. Well, if the umbilical tissue is not a neurovascular bundle, then nothing is.
Yeah.
So that's what I use, that concept that we can use Wharton's jelly in the United States with neurovascular bundles such as carpal tunnel, ulnar tunnel, diabetic polyneuropathy, all those type of diseases. So I think it does fit that classification, but that's my opinion. I'm not sure that's the FDA's opinion, but I guess I'll find out when I get back.
Well, and they said they're changing that now, though, right? Or that's kind of the plan?
Well, that's in stone right now. 351, amnio is a drug.
Got it.
And has to be in a new drug application and has to be through a IRB, Institutional Review Board, that's legitimate. And those results are going to take 10 years to find out what the results are.
That's crazy.
Isn't that kind of unusual? Because Wharton's jelly is in 361.
Yeah.
But now, like Dr. Reardon's clinic signature, I understand he is going to be in 351 because he uses a solvent, I think, I'm not exactly sure, to manipulate the Wharton's jelly.
Yeah, because if you just go straight from the Wharton jelly, when you're dissecting it, you've got it in the lab. I mean, it's like the first 3 rounds of culture essentially just getting rid of like all the other cells there. You know, it isn't until about the 3rd round that you even have just pure mesenchymal stem cells. So I guess you would, if you're using the liquid there, then now is it still minimal, right?
Right. So these are technical terms, but overall, they're safe and effective because they wouldn't be doing these 351 studies if they weren't safe. And why would anybody spend a couple $100 million to prove something is not effective?
And you can't.
That doesn't make sense.
And it just makes no sense. Yeah, I saw there was a patient sent me a video the other day. It was real interesting, and it was about urine of all things. And they've done a lot of studying with urine over in China. And one of the sections was how these 2 guys won. I can't remember if they won a Nobel Prize for it or something similar, but for neural stem cells. And it was actually using baby urine for that, which the amniotic fluid is like something like 90% urine. Mm-hmm. And they had to use the urine to be able to cultivate the neuronal stem cells to make it work. So it's but then I guess now it's classified a drug. So
yeah, Lucy is not going to be happy. I'll have to talk to Don Johansson. He was the one who discovered Lucy in the 70s. And I guess Lucy is a drug dealer.
She's a drug dealer.
Yeah. And any pregnant woman is a mule.
Yeah.
So there's where you can get your drugs for pregnant women. So
it's crazy.
It is crazy. But it's not to say we don't need more studies. Set back to Dr. Kurtzberg and her laboratory at Duke. She's done phenomenal work. But I said, when I had that discussion with her, I said, well, when we think about it, it's not a genetic disease because it's reversible.
Yeah.
And also, you're giving the same dose to somebody with autism as the same dose to somebody who has muscular dystrophy. That's got to make you think, are they different diseases or different locations of where the inflammation resides? And that's kind of my theory.
It makes a lot of sense.
Right. So when you go back in the 1800s, and I'm closer to the 1800s than you are, when you look at Charcot and all these famous physiologists for Cal, for instance, they were looking at these things and putting labels on.
Yeah.
Charcot foot, Charcot-Marie tooth, even more recently, Alzheimer's, early 1900s. That's, in my opinion, that's not a disease. It's a description of an inflammatory process in different particular tissues. And it does change the genetics and the epigenetics.
Yeah.
And they shuffle those genes. And if you carry those alleles on your genome, you're going to express for that itis, inflammation. And even in Dr. Reardon's book, he talks about the function of stem cells, how they work. Basically, they're anti-inflammatory, number one. And number two, they're anti-fibrotic. In other words, they resolve scar tissue.
Yep.
And when I studied with Dr. Dellon years ago at Johns Hopkins, who's the world's leading authority on peripheral nerves, and that's the question I asked him. The first question I asked, Dr. Dellon, is this an itis or an osis? And he goes, wow, that's a good question. He said, well, it's both. Itis, meaning inflammation. We were talking about diabetic neuropathy. It's inflammation. And how does the body heal? By fibrosis, scarring. If you cut yourself, that's certainly inflammation, and the body heals by scarring. And that's acute. But chronic inflammation takes 40 years at least in the diabetic population to create that inflammatory to fibrosis, and it affects all tissues throughout the body. And we can get into that in another section.
Well, you see a lot of that. I mean, that's one of the main things you see, right?
That's my field. So to me, it's rather straightforward. Inflammation, fibrosis. I can do the surgery. I can write for the prescription. I can use Lyrica in diabetic neuropathy. I can even spell that one. I think that's with a Y or an I. I'm never sure about that. But that works in the central nervous system, so you don't feel the symptoms of the lower extremity. Now, Dr. Dellon, he has brought forward this concept of neuropathy is a compression neuropathy, and we didn't talk about that.
Yeah.
But the nerve, the artery, nerve, and vein, when they go through a tunnel, biochemically sugar converts these different chemicals to cause the outer layer of the nerve to shrink, like a shrink wrap, and that's called the Maillard reaction. And then when the nerve is converting sugar inside the nerve to sorbitol, another chemical reaction called the polyol pathway, and that pulls water into the nerve. So the nerve is swelling as the covering of the nerve is compressing. My contribution was with Dr. Cook up at Stanford, his molecule asymmetric dimethylarginine. No, I'm probably losing the audience here. They're probably dozing off here, but
no, this is interesting.
So asymmetric dimethylarginine. He wrote an article, Dr. Cook, John Cook, should read this article if you're interested in science. It's Cook with an E. So his molecule is called asymmetric dimethylarginine. I read that article, it was in the year 2000 in Circulation, and he called it the Uber marker. Now, John is a cardiologist by training. He's got a PhD in vascular biology, and he ran the Raven Clinic, Gerald Raven's original clinic at Stanford for years. And I read that article, and I texted him. I said, hey, Dr. Cook, that was a great article, and I think it has something to do with Dr. Dellon's theory of diabetic neuropathy. And he called me like 2 hours after I texted him, and I thought, wow, it does that. Calls me, he said that he did a literature search. No one had thought of that connection. He said, why don't you come up to Stanford, which I did in about 2005, I think it was. And I used his molecule, asymmetric dimethylarginine. Now, let me break that word down. It sounds complicated, but it's not. So arginine is semi-essential amino acid, 2 methyl groups. Asymmetric, both those methyl groups are on the same side. That's what it means. So what does it do? Well, it blocks the nitric oxide pathway. And that is what we did, the studies were see if that did block the nitric oxide pathway. Well, 17 years ago, that was not known. Now it is known. That's what it does. And it blocks the blood supply to any nerve throughout the body, not just diabetic neuropathy in my field. So that's its basics. Now, taking that one step further, or 15 steps further, this is how I think stem cells work.
Yeah.
So we get into growth factors. And there are at least 500 growth factors. Thank God I'm not in medical school, because we'd have a matching test for that. Oh, sure. Right. Then we get bogged down in memorization. But let's make it simple. So Dr. Cook's, this is him speaking now. His molecule that he likes is asymmetric dimethylarginine. He also talked about, and this is almost 20 years ago now, VEGF, vascular endothelial growth factor. Now, Dr. Cook is a cardiologist by training. By the way, he's now head of stem cell research for the United States at Baylor. He's using inducible pluripotent stem cells, making new hearts. But we'll talk about that another time. But this is 20 years ago. So I said, Dr. Cook, can you help me try to understand this molecule, which he did. And when you really think about it, in nature, just like the umbilical tissue, it's already there. The answers are there. We didn't make this up. We just unraveling this mystery. That's all it really amounts to. So how do stem cells work? Now, there's a fellow by the name of Ian White. He's a PhD investigator, and he did an amazing experiment to me. He showed on film a nerve seeking out tissue that's inflamed. And what he was saying was the nerve precedes the blood vessel, and it makes so much sense, like a cat's whiskers in the dark. It's trying to find tissue, and the whisker, the nerve, the axon, the smallest part of the nerve, is seeking that tissue. The blood vessel follows that, and it just makes sense to your metaphor of construction company. Mm-hmm. The blood vessel comes to that. The architect is the nerve.
Yes.
What do we need to build here? And it sends a periocyte, which I think is really the MSC, by the way.
Yeah, that's
and it looks like an amoeba, and it's on the back of this little vessel, and it's inching its way towards the darkness, the fibrosis, the problem, with this chemical vascular endothelial growth factor, and it starts to build blood vessels to repair and lay the groundwork for the rest of the growth factors to follow in. What do you think? First 15 lawyers? First, the lawyers come first, and then the architects?
Yeah, the lawyers are always
right.
It's in the U.S.
Yeah, and the FDA, they have their own growth factors. Well, the FDA, 351, 361, all this stuff. But fundamentally, these growth factors come in and are assessing what's needed for this particular tissue to survive.
Yeah.
And they could be the brain-derived growth factors. There's over 500.
Yeah.
So it's a mechanism that's been around since day one, and we're just unraveling this mystery. And that's why it's taken so long for it to be as well established. But I've been doing this for at least 15 years. I've used it on things I would never believe that it would work on. And patients would say, I don't want surgery. I said, well, I can't repair a fractured bone. Well, let's do it. Well, it's amazing. It really is amazing. And here I am.
You're loaded up.
I'm loading.
We're all done now.
Yeah.
And, we'll get these working through you, looking for inflammation, looking for things to heal.
Yep.
All right.
Let's have at it, boys.
Well, thanks, Doc. And thank you at home. You can get a hold of us at Dreambody Clinic, www.dreambody.clinic. Happy to help.